A few months back, I was asked to consider serving on the board of trustees of the Greater Carolinas chapter of the National MS Society. After researching the condition, I agreed. I attended my first fundraising event this past Saturday, and I am sure I made the right decision. Let's talk about multiple sclerosis, commonly known as MS. What is it? There is much to be said about this disease, but simply put, it is a disease that affects the central nervous system. The immune system attacks the myelin, the protective layer around nerve fibers, and causes inflammation and lesions. This makes it difficult for the brain to send signals to the rest of the body. The symptoms of MS can vary widely depending on the location and severity of nerve fiber damage in the central nervous system. Common symptoms include numbness or weakness in one or more limbs that typically occurs on one side of your body at a time, tingling, electric shock sensations that occur with certain neck movements, especially bending the neck forward, lack of coordination, unsteady gait, or inability to walk, partial or complete loss of vision, usually in one eye at a time, often with pain during eye movement, prolonged double vision, blurry vision, vertigo, problems with sexual bowel and bladder function, fatigue, slurred speech, cognitive problems, and mood disturbances. No single test can diagnose MS. Medical history, neurologic exam, and lab tests help healthcare providers rule out other diseases and confirm the MS diagnosis. To diagnose MS, healthcare providers must first exclude other possible causes of neurological symptoms through the tools and tests, such as blood tests to rule out any other disease condition, spinal tap to check the pressure in the central nervous system and identify inflammation or bacterial infection. MRI of the brain is performed to check on MS lesions on the brain and the spinal cord, and nerve conduction tests to assess the nerve conductivity. According to an article in the Journal of the American Academy of Neurology, MS has historically been underdiagnosed and undertreated among African Americans. Recent evidence suggests that African Americans with MS have a different clinical presentation, increased disease incidence and burden, and worse long-term outcomes versus their white counterparts. Due to limited data available for African Americans in MS clinical trials, it is difficult to make informed, generalizable conclusions about the natural history, prognosis, and therapeutic response. We now know Black people have an equal or greater chance of developing MS as other racial groups. Black women are particularly at risk. There is a pressing need to increase knowledge about and understanding of MS disease manifestations in African Americans. The National African Americans with Multiple Sclerosis Registry is intended to be a platform to advance the care of African Americans with MS and address health disparities they may experience. Their website is www.naamsr.org. There is no known cure for MS yet. However, treatments can substantially improve the symptoms. Early diagnosis, as in other diseases, is key. If you or someone you know is experiencing some of the symptoms mentioned earlier, please be an advocate for yourself and ask your healthcare provider about testing for MS. It is often not even considered as an option for African Americans due to the widely held and incorrect belief that we can't have it. If you have any questions about the information I just shared, please reach out to me, Dawn Daly-Mack RN, at 252-410-1717. And remember, Black health matters.